the doctor, she looked at me like this, said, look, you don't, this is not because of the injection, and don't say this is because of the injection. I said, I'm telling you, I got this pain on my chest after I got the injection.
The mainstream media can no longer ignore the elephant in the room, but will they ever acknowledge the role that they played in generating stigma against vaccine reaction sufferers? Tamara Ugolini here with Rebel News, and as countless stories of vaccine injury poured in after the mainstream media featured the story of a Quebec man who suffers from a vaccine-induced skin reaction that has turned his life upside down, this acknowledgement hints that the otherwise complicit media is aware of the breadth of vaccine injury plaguing Canadians, and it isn't as rare as they would have had you previously believe.
Every moment I'm going to any, or every visit I'm going to any doctor or taking anything, I'm wasting my time, I'm wasting my health, I'm wasting my body, and it's a hopeless case.
It's a story that I featured in the spring of 2021 when emergency room physician Dr. Patrick Phillips was having all of his post-COVID-19 vaccine injection injury reports rejected by his medical officer of health. A move that saw him face investigation and have his license stripped for simply following the science and trying to uphold safety signal data collection. And because there are various arbitrary requirements and stipulations to jump through to meet the rigorous vaccine reaction submission criteria, such as time cutoffs as short as 30 minutes post-injection, there is an existing concern that valid reactions are being filtered from the Canadian Adverse Events Following Immunization Surveillance System, also called CAFIS. Two now ousted nurses from the same hospital further allege that stacks of COVID-19 injection adverse events went mysteriously missing during their shifts, and that patients suffering debilitating effects were being gaslit into psychological evaluations instead of being treated for their physical ailments. It's well documented that drug adverse events are severely unreported. On average, 95 to 96% of drug reactions never get reported. That's huge. All of the official government-led reporting systems are passive systems, including CAFIS, which is why a satellite system, now known as CARES, or the Canadian Adverse Events Reporting System, was developed very early on in the injection rollout by a concerned Canadian named Max Daigle.
Go talk to these people. Find out for yourself, okay? And don't hide it, We can work through all this all together. You don't have to be on two sides. Let's work together. Let's find out.
He developed this active, not passive, bureaucratic, multi-layered filtering surveillance system, which engages directly with the person being affected and afflicted by an adverse event. Through independent analysis and review, he discovered that there were certain patterns emerging with the adverse events reports being submitted. It was discovered that the majority of injection receivers took the injection not because of safety concerns, but because of employment requirements. He also discovered that 97% of recipients needed medical attention, 33% required urgent care, almost 24% sought the assistance of a healthcare practitioner, and 23% sought a specialist, while 17% needed emergency medical services, or EMS. More than 12% of adverse events were life-threatening or fatal. 73% of reactions became chronic afflictions. And shockingly, of the data that he was independently able to verify, collect, and review, less than 4% of these reports made it into Health Canada's system, with a shocking 96% never having made it into the CAFIS system at all. Most commonly, the systems involved in the reaction was a neurological one, followed closely by cardiovascular and musculoskeletal ailments. Many respondents reported, though, that more than one of their systems was affected, and most often that meant at least 2 or 3 systems were affected by neurological disturbances. And when this system the care system was first rolled out and soliciting reports, of course, in swoops the mainstream media to smear the initiative instead of highlighting the shortfallings of the government-run passive system that was literally filibustering documentation and gatekeeping the reports. This is the same media outlets that unwaveringly and unquestionably towed the safe and effective line, even while novel pharma brands were pulled from the markets due to safety concerns.
Once we get more and more data and get the overall safety of it, I think that we'll have a much better idea. But again, I think we really should look at UK and see 11 million doses and no major safety signal.
But it appears increasingly difficult to ignore this elephant in the room. The same media that repeatedly acted as the social enforcement arm of the COVID regime, from defining any skepticism or criticism of the government-sanctioned COVID response as misinformation, to promoting state-imposed punishment of COVID dissidents through snitch lines, the normalization of shuttering of small businesses, and the ruining of one's life's work in the name of public health, to condoning and even promoting the isolation of developing children and adolescents, and the squashing of dissident doctors or those whom provided exemptions, be it to the indiscriminate masking or vaccinate or else mandates. Is the mounting anecdotal evidence of suffering and vaccine reaction stories becoming too difficult to ignore? Will the mainstream media start to ask accountability questions to government officials who regurgitated that safe and effective narrative from Big Pharma? The same government officials who have capped the vaccine injury compensation program halfway through its first year for a program that only planned to have a maximum of 400 claims processed each year, which as of December 1st, 2022, they had already received 1,299 claims, but processed only a mediocre 50 to have made it through that intense filtering process with ambiguous criteria to be approved for final compensation. Well, people who took the injections to remain gainfully employed are now disabled and unable to work anyway, leaving them without income as they face spiraling inflation and unfettered increases to interest rates. How is that for a government that repeatedly stated throughout the COVID narrative that they would have your back? For Rebel News, I'm Tamara Ugolini. The statistics sourced about the Vaccine Injury Support Program came from our exclusive access to information request filing. And we can only continue this kind of independent investigative journalism with your help at rebelinvestigates.com. At that website, you can check out our other exclusive reports and help offset the costs of ATIP filings, appeals, and follow-ups. That website again is rebelinvestigates.com.